Hello, good afternoon. Hello, everybody. Welcome to Birth Control Tuesday with Dr. Sophia again. I'm Juliana. I'm in here, like I say, with our co-founder and Dr. Sophia again. We are so lucky to have her every Tuesday to answer the most popular questions regarding birth control. And today we're going to talk about a new birth control that is, for me, I'm pretty not used to this new method. But before we get started with that, just want to mention that if you guys, girls out there have an active prescription for birth control and would like to skip the trip to the pharmacy, you can sign up with Pandia Health to enjoy our free delivery service and forget about going to the pharmacy every month, and you can also enjoy our free goodies in our packages. And if you are in California, Texas, Florida, Arizona, or Wyoming and need a new prescription, we have wonderful doctors that can prescribe you within 24 hours from the comfort of your couch, of your bed, wherever you are, in the library, wherever you are with your phone and Wi-Fi, you can get a new prescription with our doctors. Thank you, Sophia, for taking the time to chat and answer our questions. Let's get started then. The first questions we have is, what cancels birth control?
So I think what makes birth control not work, or what medications or what herbs or supplements can affect your hormonal birth control such that it doesn't work. So because the IUD, there isn't any medication that should block the effect of the copper IUD. However, any method with hormones, such as the IUD with hormone, the implant, the shot, as well as the pill, the patch, the ring, all of those have hormones in them. And they're medications that your body processes through its liver, or definitely goes through your mouth and then to your liver. And then there's also some what's called enterohepatic circulation. So entero means eating area, hepatic means liver, and circulation means moving around. And so the reason I bring that up is there are antibiotics that can block the effect of the hormones because it may kill the bacteria and stop the enterohepatic, so the moving around of the hormones from your stomach system to your liver system. So that's number one. However, the research has shown there's only been 2 specific antibiotics that have been proven to do that: rifampin and griseofulvin. Rifampin is generally used to treat tuberculosis. So if you don't have a diagnosis of tuberculosis, then it's very unlikely that you're on rifampin. And then griseofulvin is used for fungus. And usually griseofulvin is taken by mouth and used for fungus of the head or the toes or the fingernails. So if you are using any of those kinds of medications, antibiotics, then you're at risk of your hormonal birth control not working. And then common medications that are over the counter that you don't need a prescription for, that your doctor may forget to ask you, or you may forget to tell your doctor that you're taking, that can affect your birth control, is number one, a very popular cold medicine called pseudoephedrine. So pseudoephedrine revs up your liver. And then your liver is the thing that cleans out any medication in your body. And so if your liver is all excited and working really, really fast, then it will eat up your birth control, and your birth control won't last as long. And then the other one that came up today is St. John's wort. So St. John's wort is often used for people for depression. And that is not prescribed by a physician. And what's dangerous from the doctor's point of view is it's not FDA approved. So the FDA has a very rigorous process, and they test everything and they inspect everything, but any herb, vitamin, supplement is not FDA approved. And so they've actually done tests where they take a bottle of St. John's wort and it says 100 milligrams. But inside, when they test it in the same bottle, not like in different bottles, but in the same bottle, there is 0 milligrams of St. John's wort and there is 1,000 milligrams of St. John's wort. But nobody's testing it because there's no legal quality kind of stuff on herbs and supplements. But the reason why St. John's wort has an issue is it's been shown to decrease the efficacy of hormonal birth control, and probably the same kind of effect as pseudoephedrine is it's revving up your liver because the body's trying to process the St. John's wort and gets very excited and very busy. And then it also eats up your birth control so that your birth control hormone level is lower and it's not working. So we recommend that you do not take St. John's wort with your birth control pill, patch, or ring. Or if you do, then you use a backup method such as condoms or abstain from sex. And then other medications that have interactions with birth control are seizure medications. Not all seizure medications, but definitely if you're on a seizure medication, tell your doctor so they can look it up and see if it has an interaction. But those are the ones off the top of my head.
All right. So we go, I think that the tuberculosis one is pretty easy to remember. The one with fungus, it's easy to remember as well. Pretty important, the one that is sold over the counter, like the one to treat any kind of flu, I guess, right?
Yeah, so pseudoephedrine is oftentimes in a lot of combination drugs. Like my favorite combination drug, I'm usually a purist. So if you have a runny nose, I like to treat it with Sudafed. If you have a cough, sometimes it's postnasal drip, so the answer is also Sudafed. But if you have a sore throat, then we want to, deal with that situation. The separate drug for everything. But to go to bed at night, I really like NyQuil. And so pseudoephedrine can sometimes be a NyQuil, or sometimes there'll be diphenhydramine. So you have to look at the ingredients. It won't just say Sudafed. You have to turn it around in your flu medicine, especially with flu season coming. This is very important. Brilliant question. Yeah. To turn around your cough medicine and look what medications are in there. And if pseudoephedrine is there, not good for your birth control necessarily. I would say that it hasn't been, a big research paper, but it personally has happened to me many times.
All right. So
and the way that you know that it happened is that if normally you're on your birth control pill and you maintain a hormone level and then you drop it, and when you drop it, that's when you get some breakthrough bleeding. And so if you get breakthrough bleeding when you're not supposed to be bleeding on your birth control pill, patch, or ring, that is an indication that maybe your birth control is not working.
Oh, wow. Okay, I didn't know that. Good to know. So random spotting is not just, breakthrough bleeding can be a sign of that something is not going right. Yes. That you might be not protected. Is that correct?
Yes. Yeah. Oh. If you want to, yeah. Yes.
Wow. Good to know. All right. So we have all those different medications that can cancel or make your hormonal birth control stop working. And then our women out there are wondering, what is this new birth control gel? Is that non-hormonal birth control gel? What can you tell us about this? I have never heard about it, so I'm pretty curious.
Yes. So I think the reason you haven't heard about it, one, is there's a new birth control gel. We've always had the category of birth control called spermicide. And what spermicide does is it kills the sperm, or it stops the sperm from moving. This new one works by the vagina has a natural pH of acid. And acid is a lower number, so 4.5 or below. And so my understanding of this new spermicide is it takes it down to acid level, and the sperm itself actually has a higher pH of 7, alkaline, or 9. I don't know the exact pH, but I know that it's more alkaline and the vagina is more acidic. And so when you take the pH down to an acid level, the sperm is not as happy in this type of spermicide. I think that there's a new move maybe to non-hormonal contraception, but you need to be careful. Just because it's a new thing doesn't mean it's better. And the reason why is the spermicide works about 83% of the time, which is about the same as using a condom, but maybe a little less. I always recommend condoms plus something. So condoms plus spermicide, condoms plus a hormonal method, condoms plus the copper IUD. But I would never use spermicide alone. But there is a new non-hormonal contraceptive, but I wouldn't use it alone if you want to prevent pregnancy, because the birth control pill has an efficacy of 97 to 99% if you're good at taking it. If you are forgetting it and miss 1 or 2 pills every week, then it's going to have a lower efficacy level. And a lot of people are afraid of hormones, but actually it's more natural I think to have fewer periods, and you can only do that with hormones. So there is a new birth control out there. It's non-hormonal because it's a spermicide, but it doesn't work as well as the hormonal options.
Of course. Do you know the percent so according to the research, how
well it works?
Yeah.
So it prevents 83% of pregnancies, but that was in their research. And so when a company is presenting their research, they usually do perfect research, right? Like they're paying these people money, you're going to use this and we're going to check this, but they didn't check it over, a year. And do you remember to use it at the right time? So there is perfect use and there's reality use in terms of the efficacy. And then to me, it's just like, why would you use something that has a greater chance of pregnancy when there's things that are better? But I would definitely consider it if I couldn't use hormones or if I didn't have sex that frequently. So if I only had sex once a month, then I would use absolutely a spermicide plus condoms. But the question is this spermicide any better than the previous spermicides that have existed? So the previous spermicides are usually non-oxyl 9, and they come in the form of foam. They come in the form of a suppository, a little thing that looks like a little bullet, and you put it in and it melts in there. And then it also comes in the form of a film. So it's just a little square film that you put in your vagina and it melts in there. For me, using that alone, what if it only covers this part and then the sperm shoots up here and doesn't touch any of this and doesn't get killed? If I don't want to be pregnant, I really don't want to be pregnant. So it's absolutely new. It's absolutely non-hormonal, but it doesn't work as well as the hormonal. And I'm curious how it compares to that. It probably works the same as the other spermicides that are out there. So to me, it's not anything new, but obviously the company wants you to think it's, new and special.
New, right. So here the next question then, why is the main difference? Is it just because it's a gel and the other one was in a foam format?
I think it's the format. So the foam one I always thought was really fun because I don't know if you've ever used the hair foam, right? The hair foam.
Oh yeah. Well,
I know. The mousse. The mousse.
Yeah, the mousse. Yeah.
So the spermicide mousse is the exact same bottle, and you just put a little a vaginal applicator, and it goes zoop, and it shoots up, and it has this little thing, and and so you stick it in your vagina, and you squirt it up, and you go floop. The key to know with all these methods is it doesn't protect against sexually transmitted infections. And that's why I'm always like condoms plus. The other thing is I wonder the gel, the mess, right? I don't like mess. And so even though I'm married and have 2 kids and have been with my husband, we had our 25th anniversary, we use condoms because I don't want to be left with the mess and have to drip out of my vagina for for the next, day of just mess. And so with a condom, so much better. And without a condom, then, an issue. But you definitely, again, could use condoms plus spermicide. But using spermicide alone, you are risking sexually transmitted infections, and it's not as good as the hormonal options.
And talking about how to use it, I'm curious to know, so it's only in using the vagina, right? Can it be used on in men's?
Only in the vagina. Because the penis ejaculates sperm, and there's 250 million sperm squirting out. As any of you who've ever seen, a condom, when you've got the sperm, that's like squirting out. So if you put it at the tip of the penis, it's just going to squirt right by, and the sperm is not going to. I think some people have maybe created or thinking about creating like a condom that the sperm as it shoots through would get shredded, so it'd be like shredded. Or they've thought of, putting things in the man's tubes, the vas deferens, such that as the sperm goes through, it gets shredded or killed. But if you're going to do that, you might as well just do a vasectomy, or they do have a temporary plug that they've put in there in India. The question is, like, when it fails, is it going to be okay, right? Like, when you get pregnant and it didn't work, it shot out, oops, then you're pregnant. So as the person who has the risk of pregnancy, I want to make sure that I have it under control. And so I think that's why I really like the woman having something, and then the condom for the one with the penis to take his responsibility and not leave me with a mess.
All right. That's fair enough. I like it. I like your point. Totally. So just trying to zoom up a bit. You, as a doctor, you wouldn't recommend using this non-hormonal gel? Not
by itself. I would use it with a condom, but you could absolutely use it by itself. You just need to know the risks, right? And if you're willing to get pregnant 17% of the time, go ahead. Oh
my goodness, that's way too bad. All right, because we, like you say, just also bring it back again. The numbers, so spermicide only protect you 83%, you say?
Yeah, I think roughly 83 to 85%. Condoms are similar, and then the birth control pill is 92%, maybe if you're not so good at taking it, 95 to 99 if you're better. The pill, the patch and the ring have a better efficacy because the ring you only have to think about 13 times a year. The patch you have to think of 52 times a year, but the pill you have 365 times a year that you could mess up on. So I think condoms with spermicide is fine if you're having sex once a month or so, and then always have some emergency contraception in case the condom pops. Like, you could actually do it that way too. You could do spermicide, condoms, and always emergency contraception if the condom pops, just to be safe.
100% safe. All right.
Yeah. Oh, and we have a good blog if people want to Google Pandia Health Birth Control Math. So we have, your chance of getting pregnant with just spermicide, your chance of getting pregnant with condoms, and then the chance with the two together, you actually multiply it, and that decreases your risk of getting pregnant. And then the same thing with the birth control pill versus with condoms, and then together decrease your risk of getting pregnant.
All right. Wow, I didn't know about that. I need to search the resource, and maybe I can put it in the comments so people can check it out later on.
Smart.
That's good to know. Oh, so we have this new non-hormonal birth control method that is not that good if you just use the gel over the spermicide. We can say that it's not good because, first, I don't like the fact that only women can get it. I mean, only women can use it, right? It's a bit unfair. Like, it should be women and men. So Dr. Jane recommends to use spermicide or the gel with a condom just to be more safe, since this new gel is not as good as another hormonal birth controls, right?
Yes. And the other thing, I'm not sure about this new spermicide, but spermicides need to be used every single time you have sex, because there's not enough to kill if you had multiple injections of sperm. It's only good for that one time. And so if you have sex again, you have to put some more gel up there, or more, whatever form of spermicide that you're doing. Just an FYI.
Good. Yeah. Good to know as well, because you will end up with such a mess. That will be too much.
If you have multiple sex. Oh, that's the other thing I read, that if you use this new one and you have a history of urinary tract infection, which a lot of women do, then it's not recommended, or it's not as good of method. So make sure that if you have a history of urinary tract infections that you might not want to consider spermicide. And mainly what that is that your pee hole, your urethra, is right above your vagina. And so if you have a lot of lubricant or, spermicide or wet things, it could block up the pee hole. And so then you get a urinary tract infection. So it's very important. A lot of people say right after you pee, right after you have sex, get up and go pee. So then you've cleaned out the pee hole so it doesn't get blocked up and you get a urinary tract infection. So yes, with spermicide, and specifically this new one, I think because they tested it, not because other spermicides don't have this risk, or maybe there's something special about the spermicide, it's extra gooey or something like that. There's an increased risk of urinary tract infections. And they said if you have a history of urinary tract infections or any kidney thing related to urinary tract infections, then maybe this is not the method for you.
Right. Good to know as well. And good to know, it's great that you brought up the fact that you need to go to the toilet after practicing having sex. I think that that's something that we women are not ever told. And then we find out when we are a bit adult.
When we have the urinary tract infection.
Yeah, that's it. That's right.
Or bidet. I mean, you could do a bidet or just a little shower rinse, or, but peeing is probably the best because you're pushing out anything that's blocking the urethra, the pee hole.
Awesome. Yeah. Alrighty. So I think that we have covered all the questions for today, Dr. Jen. Thank you very much for answering our questions regarding this new trending birth control. Even though it's not as good as other birth controls, as you mentioned, it's good to know that it's a resource out there. Always take into account it's not as effective as other birth control, and it should be used with condoms. It's good to know that, if you can take the risk of getting pregnant, maybe you can use it on its own, but always better protected with condoms. Thank you very much again, Dr. Jen. Thank you to everybody that is watching. Every Tuesday we have a popular birth control questions, trending questions that the doctor will answer for us and provide us information. Information is power. Just before finishing this live, want to remember everybody that has a uterus and is taking birth control that we provide free delivery service for birth control refills, and also in California, Florida, Texas, Arizona, and Wyoming, we have doctors that can prescribe online. Within 24 hours, you can get a new prescription with a year's worth of refills. And if you're interested in a new prescription, please join us at pandiahealth.com and use the discount code TRENDING that you can see just above there, down there, sorry. Use the discount code TRENDING and you will get $5 discount. So you can get a new prescription for only $15. And we will provide free delivery service as well for you for all your refills. So thank you again, Sophia. And we will be back next Tuesday with more questions and exciting things to discuss. Thank you so much again.
Thank you so much for hosting this. And everybody, check out Pandia Health. Tell your friends. We're the only women-founded, women-led, the only doctor-led company in this space.
Thank you.